Hello, this is Dr. Grande. Today's question is, what is adjustment disorder? So adjustment disorder, as defined in the Diagnostic and Statistical Manual, the DSM, has to meet certain criteria. Now, the first criterion we see with adjustment disorder is that behavioral or emotional symptoms occur in response to an identifiable stressor. And the onset of these disturbances, or this disturbance, must occur within 3 months of that identified stressor. We also see with this disorder clinically significant symptoms, and we can think of those as being one or both of these following criteria. Marked distress that's out of proportion to the severity or intensity of the stressor, taking into account cultural factors and external context, and or significant impairment. So just one of those has to be present for the second criterion of this disorder. Now, the third criterion is the disturbance does not meet the full criteria of another mental health disorder, and it's not simply an exacerbation of an existing mental health disorder. The fourth criteria is that the presentation is not normal bereavement. And the fifth criterion indicates that if the stressor terminates, if that identified stressor from the first criterion terminates, that we shouldn't see symptoms lasting more than 6 months. It's also important to remember with this last criterion that some stressors are recurring. They're not just one-time events, but they are persistent. Now, adjustment disorder has 6 specifiers. So specifiers add information to the diagnostic classification. They're different than subtypes. So the specifiers for adjustment disorder include with depressed mood, with anxiety, with mixed anxiety and depressed mood, with disturbance of conduct, with mixed disturbance of emotions and conduct, and unspecified. So 6 specifiers for adjustment disorder. And the DSM indicates some situations where adjustment disorder may occur. There would obviously be quite a number of possibilities, but some of the ones they mentioned would be the termination of a romantic relationship, marital problems, living in a crime-ridden neighborhood, going to school, getting married, retiring, failing to meet occupational goals. So there are quite a few different circumstances that could apply here with adjustment disorder. So adjustment disorder is sometimes considered a little controversial, even though the definition is fairly straightforward. And I think one of the reasons that it's become a bit controversial is because it's considered a diagnosis that's given sometimes when the full criteria of another diagnosis can't be met. So it's like the default diagnosis. And as I mentioned, that's really not what you see when you look at the definition, but for some reason adjustment disorder has kind of taken on that role. At least that's one of the popular conceptions of it. Now, it's interesting because there are other diagnostic classifications when the full criteria of a mental health disorder aren't met, including other specified mental disorder and unspecified mental disorder. So it's not really clear why adjustment disorder has taken on this reputation, that it's the go-to diagnosis when a clinician can't figure out or doesn't have time to figure out what the actual diagnosis is. I think it has unfairly earned that reputation if you look at the clarity of the definition. The problem is probably more centered around the wide variety of circumstances that can be applied to this disorder, as opposed to anything wrong with the actual definition. As I mentioned, the DSM listed quite a few. There are many more. Any number of stressors could be made to fit with this diagnosis. And that's probably why we see such high prevalence, 5 to 20% as listed in the DSM. And in hospital settings, it's the most common diagnosis, up to 50% of the time. Another reason for the controversy around adjustment disorder is it fits with this narrative we see sometimes in mental health, that the mental health field is trying to pathologize every normal condition, trying to make it so that anybody qualifies at any time for a mental health disorder. And adjustment disorder is part of that scheme or that plot. Now, I can understand this criticism, but if you look at adjustment disorder, it does have that specificity I mentioned. There has to be an identifiable stressor. So if they're misusing this diagnostic category, it's simply a choice they're making, or there's some deficit in training or experience that's resulting in that behavior. I don't see this diagnosis as part of some overall conspiracy to pathologize. I do agree that some of the mental health disorders in the DSM have unclear definitions and have been misused, but that blame can't all be put with the DSM. A lot of that has to rest with the mental health treatment community and how they're using these diagnostic categories. Another important point with adjustment disorder is the timing. Say that a stressor occurs, and it's not recurrent, it's just a one-time stressor. More than 3 months go by, and then we see a disturbance. This would not qualify as adjustment disorder, but it may qualify in another category, other specified trauma and stressor-related disorder, or unspecified trauma and stressor-related disorder. Similarly, one of those two disorders could be considered if a stressor ends and the symptoms continue for more than 6 months. I hope you found this description of adjustment disorder to be interesting. Thanks for watching.